So what is the name of all that extra on your chest? Well, despite what you or your buddies call it, the proper name for all that is gynecomastia. It's a benign overdevelopment of glandular tissue in the male breast. Now you're probably saying, male breast? Men aren't supposed to have breasts. I know. It seems weird, but in reality, the default programming for people is to be born female. So that means you come built with glandular breast tissue in place already. But at one point in the womb, the SRY gene on your Y chromosome kicked in, and boom, you developed into a male. Gynecomastia can sometimes be confused with pseudogynecomastia, which can look the same, but is really an excessive development of fat below the areola without a glandular component. Gynecomastia is overall a benign condition, but the problem lies in what society tells us that the male chest should look like to be attractive. And having a breast-like appearance is one that is not often celebrated for men in our society in a very good way. So what causes gynecomastia? The main root cause of gynecomastia is estrogen, either from excess levels in the blood, decreased testosterone levels to where estrogen is higher in levels by default, or increased sensitivity of breast tissue to circulating levels of estrogen. There are three main times in a man's life where estrogen is in a higher level than testosterone. The first is just after a male baby is born. Estrogen levels from your mom remain circulating in your blood for a bit before eventually dropping off. The next is puberty. During this time, a male may experience higher levels of estradiol in relation to their testosterone levels. These higher levels of circulating estradiols can activate overgrowth of the glands in the male chest, leading to gynecomastia. Now, in a lot of cases, gynecomastia in puberty tends to go away as we get older, but for a lot of us, it sticks around in varying degrees of severity. The last time in a man's life where gynecomastia can become a problem is when we get older. Our testosterone levels go down, the remaining testosterone gets converted into estrogen in the liver and other tissues through a process called aromatization. This in turn leads to overgrowth of the glands in the male breast, resulting in gynecomastia. Gynecomastia can also be caused by several medications that you can see here. There are other drugs that can cause gynecomastia as well, such as HCG, human growth hormones, anabolic steroids, marijuana, alcohol, amphetamines, heroin, HIV medications, methadone, and others. Some medical conditions that can cause gynecomastia are testicular tumors, liver cirrhosis, pituitary gland failure, chronic renal failure, HIV, Klinefelter syndrome, congenital anorexia, adrenal tumors, obesity, hyperthyroidism, and others. Now that we know what causes gynecomastia, let's talk about how it's classified. Gynecomastia has three different types in its classification system, which is based on the degree of tissue and skin excess. So type 1 gynecomastia has minor breast enlargement without skin excess. Type 2 has two different subtypes. Both have more moderate breast enlargement, with type 2A having no skin excess, whereas type 2B has some minor skin redundancy present. Type 3 is the most severe form, where patients have gross breast enlargement with skin excess that causes a hanging breast. There's also a staging system of 1 to 4 based on the size of the gland, but we won't dive into that here. The reason that we classify gynecomastia is that it gives us a better way to plan for your surgery. The surgical plan for a type 1 gynecomastia is going to be way different than a type 3 gynecomastia. The main way that we determine your classification is through a physical exam. Once you're in the office, we'll discuss your medical history and talk with you about when it first developed, how long it's been around, and if you've been taking any medications or using any recreational drugs long term that are known to cause gynecomastia. On your physical exam, we'll check your thyroid for any abnormal nodules and do a breast examination to determine a few things. One, to feel for any abnormal lumps or bumps, because on rare occasions, men get breast cancer too. Second, to help determine if you have true gynecomastia versus pseudogynecomastia. How can you tell on exam? Well, with true gynecomastia, when you grasp the breast tissue between two fingers, you can feel a firm, rubbery mass back behind the nipple. With pseudogynecomastia, this rubber-like mass is missing. The final part of the exam involves a testicular exam, because there are cases where testicular cancers can cause gynecomastia. Cancers such as Leydig or Sertoli cell tumors can cause gynecomastia. You may also be sent for blood work to help determine the cause of your gynecomastia. Blood work such as testosterone levels, thyroid levels, luteinizing hormones, and human chorionic gonadotropin levels can also be checked. Try and say that 3 times fast. If any abnormal findings are found on the testicular exam, then you'll be sent for a testicular ultrasound to evaluate it further. Once all of that is done, we can then go ahead and talk about the plan to get rid of your gynecomastia. There are medications that can be used to treat gynecomastia, but in general, once you have it, the only way to really get rid of it is through surgery. Surgery involves directly removing all of the gland, as well as possibly some liposuction to help improve the results further. It sounds simple and straightforward, but it's not that simple, and if you want to learn more about the surgical techniques that I use to get great results from gynecomastia surgery, you can watch this video right here. I'm Dr. Paul Pearce, and I hope you learned something today. I'll see you on the next one.